apical segment of Cobb angle, has high corrective index, in adolescent idiopathic scoliosis. The Cobb angle-based, antero-posterior chest radiograph, helps in examining the level of the spinal deformity, in adolescent idiopathic scoliosis patients. This radiograph guides the surgeons to calculate flexibility, and plan the reconstruction surgery, for spinal alignment in a better way. A lot of research has been done to determine the scoliotic spine flexibility and rate of surgical correction of diverse instrumentation. Only a few studies have investigated the characteristic distribution of Cobb angle in the main thoracic curve. However, there is no clear idea regarding the characteristics of main thoracic curve. The aim of the study was to examine main thoracic curve Cobb angle distribution and compare the difference in correction rate and flexibility between the distal, apical, and proximal segments in LENC 1 adolescent idiopathic scoliosis patients. Patients with LENC 1 adolescent idiopathic scoliosis with main thoracic curve Cobb angle involved in T5 to T11 or T6 to T12 who were receiving single-stage posterior correction surgery with pedicle screws were included in the study. The patients with no medical history of spinal surgery and not receiving spinal osteotomy were also included. The retrospective controlled clinical study included 40 patients. The main thoracic curve Cobb angle in the proximal, apical, and distal segments were measured on the fulcrum bending and posterior, anterior films. The preoperative Cobb angle distribution was significantly higher in apical segment than in the distal and proximal segment. A remarkable increase in bending Cobb angle was noticed in apical segment than that in distal and proximal segment. The Cobb angle immediately after surgery and at the last follow-up visit was considerably higher in apical segment than that in distal and proximal segment. The corrective index was comparatively higher in apical segment than that in distal and proximal segment. The study results indicate that the apical segment had relatively higher Cobb angle and corrective index than that of the distal and proximal segment. The surgeons should keep this fact in their mind while planning the treatment.